Ensuring a psychologically healthy workplace is a strategic priority for employers. Post-traumatic stress disorder, or PTSD, among public safety personnel, such as police officers, firefighters, and paramedics, has received a lot of attention. PTSD can occur after exposure to death, serious injury, or sexual violence, whether actual, attempted, or threatened. These are events that nurses and other staff can be exposed to when working in psychiatric hospitals. The Trauma Among Psychiatric Workers project surveyed over 750 staff who work at 3 psychiatric hospitals across Ontario, Canada. 1 out of every 6 staff, or 16%, screened positive for PTSD on a screening tool. Among forensic staff, the rate was 1 in 5, or 22%. That's about the same as reported for paramedics and police officers in other research conducted across Canada. PTSD is therefore a serious concern for hospital managers and administrators. In the Trauma Among Psychiatric Workers survey, the primary risk factor for workplace PTSD was exposure to a critical event. Almost all staff, or 96%, had been exposed to assaults, threats, deaths, or injuries while restraining patients. Chronic stressors were also a key risk factor. Most staff had been exposed to disturbing behaviors by the patients they care for, especially verbal abuse, screaming constantly, or physically resisting care. However, only 30% of staff in the Trauma Among Psychiatric Workers survey felt well prepared to prevent or respond to violence or disturbing behavior in the workplace. Prevention of PTSD in psychiatric hospitals should include both violence prevention and the implementation of effective methods to reduce other forms of disturbing behavior. Reducing workplace exposures is an essential step in preventing PTSD symptoms. Another important strategy is to effectively support staff who experience critical events. In our survey, most staff who met the cutoff for PTSD recognized that they needed help. But over 2/3, or 68%, tried to handle PTSD on their own using self-help or no help. 1/3, or 30% of staff who screened positive for PTSD or other mental disorders felt that getting help might negatively affect their job. Many staff who participated in interviews and focus groups for the Trauma Among Psychiatric Workers project wanted their managers to acknowledge and validate their experience, and to have the support of peers who understand their workplace culture and particular challenges. Many staff who participated in our interviews and focus groups wanted their managers to acknowledge and validate their experiences, and to have the support of peers who understand their workplace culture. They felt unsure about whom to contact, where to go for support, and what to do next. Because psychiatric staff can feel confused and unsupported following workplace exposures, prevention of PTSD should include training managers to recognize when staff may be at risk of developing PTSD and providing a supportive response. Ensuring that staff have timely and confidential access to mental health services is also key to preventing workplace-related PTSD. This could include in-house mental health services and increasing access to structured psychotherapy in the community. Occupational health and safety officers with expertise in workplace trauma who can keep in touch with staff off work and support a trauma-informed return-to-work process could also help reduce the burden of PTSD. Reducing workplace exposures and supporting workers effectively when critical events do occur could help workplace PTSD. For more information about our research, go to traumaamongpsychiatricworkers.net.